health constitutes just brushing? Well, you'll be surprised to find out that many people fall victim to this myth. However, brushing is not enough. A person also needs to support their oral health by flossing. According to SaveYourSmile.com, brushing without flossing is like washing only 65% of your body, while the other 35% remains dirty. Now, I want you to really think about this statistic. Would you walk out in public knowing that you only wash 65% of your body? Now, I want to ask you a couple questions that I found on WebMD. I want you to think about these questions. You need to brush and floss to prevent tooth decay, cavities, and gum disease. True or false? The second question. If my gums bleed when I floss, it means that I should not floss. True or false? Now I want you to keep these in mind while I go throughout my speech. All of us are aware of our oral health, sometimes more than others, and especially when we start having problems, which usually prompt us to see the dentist. I have worked for the University of Oklahoma College of Dentistry for 2 years in their graduate periodontics department, where I have seen the effects of advanced perio disease and how it affects that person's self-esteem and particularly their pocketbook. And I'm here today to convince you of the importance of flossing. One should floss their teeth not only for their overall health, but it also has cosmetic benefits, along with its financial impact on your pocketbook. We are going to start off by talking about how it affects your overall health. According to the article, A Few Good Reasons Why to Floss Every Day, this article is by Dr. Anton Yusuf. This article gives 3 main reasons why you should floss. The first reason, obviously, to avoid gum disease. Gum disease is caused when plaque remains between your teeth and close to your gums, which usually causes inflammation and bleeding, which is the first stage of gum disease known as gingivitis. If this goes untreated, it can progress to periodontal disease. The next reason you should floss is it prevents halitosis, which is most commonly known as bad breath, which is obviously caused with the bacteria remaining between your teeth, which produces the odor that you smell as bad breath. And this is one fact that you wouldn't think to be associated with flossing, which is to reduce the effects of heart disease. Flossing can help prevent this because it keeps bacteria out of your mouth, which, keep in mind, your mouth is another point of entry for bacteria, which the bacteria can then make its way into your body and into your cardiac tissue, causing endocarditis, which is the inflammation of the heart tissue. And the most common bacteria which causes this is Streptococcus. Now that we've discussed the overall health benefits, we're going to discuss the cosmetic benefits as well. According to another article that I found on WebMD, which is titled Why You Should Floss, flossing is often considered a fountain of youth, in that it preserves your youthful appearance by 1, keeping your teeth, 2, gum disease causes degeneration of your bone in your lower jaw, which often can make your face have a sunken appearance when you lose that bone, which often can make you appear older than what you really are. And then we're going to move on to our next point. If what I have told you thus far has not convinced you to floss, I'm going to tell you how it can affect your pocketbook, which I got these statistics from Dr. Leshner's blog, which kind of goes through general dentistry and how that portion can cost, and such as regular surface fillings, which can be as much as $300, a root canal, which is $750 per quadrant, a crown, which is per tooth, which can be $1,200, and implants, which general dentists can only perform this if there is not a lot of bone loss, which can be $3,500. But now I'm going to pass around a treatment plan, which is from the OU College of Dentistry, is where I got my statistics. And I'll keep in mind this is a college of dentistry, so the prices are considerably less than private practice. Look at that. purpose of my speech today was to convince you of the importance of flossing. As the evidence that I presented, I hope has shown you that you should floss on a regular basis. As someone who has worked at the College of Dentistry and who has seen both the financial and health impact of what not flossing can do to your health, I asked you earlier in the speech to keep in mind the questions that I had asked you, and I'm hoping after my speech that you can answer those questions. On a final note, 50% of people consider a person's smile the first facial feature they notice. Thus, it is important to maintain your overall oral health, as first impressions often last. How long is that?